Let's talk a bit about what you've learned about healthcare providers, doctors, and gay men, because everyone relies on their doctor for help. You know, what are what's the difference for gay bisexual men around getting care from a doctor around prostate cancer?
Okay, so we've interviewed and surveyed gay and bisexual men, and we've also interviewed and surveyed healthcare professionals about working with both gay and bisexual men and the broader LGBTQI population. And what we found is that basically healthcare practitioners in the main lack confidence and knowledge in terms of working with LGBTQI people. And specifically, they have least knowledge about transgender and intersex people. So what we found in our research, and there have been a number of other studies in the US that I'm sure you'll be talking to other people about this, what's kind of we're finding across the board is that a lot of healthcare professionals working in cancer want to be able to offer what I describe as culturally competent care, so LGBTQI inclusive care, where they can acknowledge the needs, potentially the differences, and address the specific concerns of gay and bisexual men with prostate cancer, as well as lesbian, trans, and other people with cancer. So they want to be able to do that, but a lot say they don't have the confidence in how to do it, they don't have the knowledge, and there's a real absence of education. And what we found in our research is that many healthcare professionals say, well, I don't think this, another group say it's not important to know about whether someone's gay or bisexual. I treat every person the same. But actually what that means is for the patient and their partner, that can lead to a lot of anxiety about, can I disclose to this clinician? Are they going to discriminate against me? Are they going to treat me differently because I'm gay? And some of the gay men said to us, I don't know if my doctor would be happy to see me die because they might be religious and they don't agree with someone being gay. And that's shocking to see accounts of that. So if healthcare professionals treat all people the same and don't ask about sexuality and don't ask about gender identity, what it means is many people don't come out, so they don't disclose their sexuality, or because they're really fearful, or if they do come out, there's a potential risk that they might experience hostility and negative reaction. And we've had a lot of accounts from gay and bisexual men with cancer who talk about the doctor actually ignoring the fact they said that they were gay, making dismissive comments, sometimes being very hostile when they came out, and that this is a real source of distress. And the other side of it, you could say, well, okay, don't come out, and then you're in a position of safety. But what that means is that your partner's then invisible, you're being treated as if you're straight when you're not, which makes you feel invisible, and you're not getting specific information which is relevant to your life, to your sex life, to your concerns. So what we really need is we need healthcare professionals to be inclusive of queer people, of trans people, to actually ask about sexual identity, to not assume people are straight, to not assume everyone's cisgender, and actually make sure that they give information that's appropriate for that person and that they're positive and inclusive when someone does disclose. And what we've found in our research is that when that happens, the patient and their carer feel much more satisfied with care, they've got much lower distress, they're more likely to be able to have a conversation about what's happening for them and their body, what's happening in their relationship, and they're more likely to be able to access appropriate information and support.